So now coming to the fracture or the injuries with the eponyms for the elbow, forearm and the wrist joint. So these fractures we have to remember some of the fractures and their eponyms, which is very much important for your orthopedics. First one is Montague's fracture. Montague's fracture is the fracture of the proximal one-third of the ulnar shaft. That means if it is the ulnar, the proximal one-third, it is proximal one-third, middle one-third, distal one-third. So the proximal one-third of the ulna, that is it is the elbow. So proximal one-third of the ulna is, there is a fracture, there is a fracture line with the radial head dislocation. Now the common nerve which is injured is the posterior interosseous nerve, that is the median nerve. Management is ORIF, that means open reduction. Since it is a drastic fracture, so there should be open reduction with internal fixation. You have to remember this only. So this is the management. Now coming to Galazi fracture. Galazi fracture is also known as reverse Montague's fracture. That means it is not in the ulna. That means it is the fracture in the radius. So fracture of the shaft of the radius at the junction of the middle and the distal one-third of the shaft. So if it is the radius, so it is the middle one-third and it is the distal one-third. So it is the proximal one-third, middle one-third and distal one-third. So in between the middle and the distal one-third there is a fracture line, and there is a distal radio-ulnar joint disruption. So distal radio-ulnar joint will be disrupted. So radius with ulnar, there is a radio-ulnar joint which is also disrupted. In it is management is ORIF, open reduction with internal fixation. Reverse Galazi, that means Galazi, reverse Galazi. Galazi is reverse Montague's, so reverse Galazi. That means it is the fracture of the ulna at the junction between the middle and the distal one-third of the shaft, like the Galazi only. But it is in the ulna. Galazi was in the radius, but it is in the ulna. And there is also a distal radio-ulnar joint dislocation. So if this is the radius, this is the ulna, so it will be the Montague's fracture, proximal one-third of the ulnar shaft. Distal and the middle one-third of the ulnar shaft is the reverse Galazi, and the Galazi will be in the radius, distal and the middle one-third of the radius will be Galazi fracture. Now coming to Greenstick fracture. So Greenstick fracture is seen in children. It is a unicortical fracture, just a hairline fracture with a concave or convex deformity, which is seen in both radius and the ulna. So these are the Greenstick fracture. And the Nightstick fracture, it is seen in the ulna, especially in the defense. When we defend some object, if someone is killing or someone is wanting to stab, if we defense it, then there can be a fracture in the ulna, which is the Nightstick fracture. Now Langier's fracture. Langier's fracture is the fracture of the trochlea. It is the fracture of the trochlea. Hume's fracture. Hume's fracture is the fracture of the olecranon process in the proximal ulna, with the elbow dislocation at the radius head. So there is a elbow dislocation of the radius head, along with there is a olecranon fracture, is the Hume's fracture. Now coming to the Barton's fracture. So Barton's fracture is the intra-articular fracture of the distal end of the radius, fracture of the distal end of the radius with radiocarpal joint subluxation. It is due to the vitamin C and vitamin D deficiency in the scurvy and rickets respectively. Chauffeur's fracture or the Hutchinson fracture or the backfire fracture is the intra-articular fracture of the distal end of the radius. Same as this Barton's fracture, intra-articular end of the distal end of the radius. Here is also intra-articular fracture in the distal end of the radius. But here is the radioulnar joint subluxation is there. So that is a loose, there is a subluxation on the loose of the radioulnar joint, but here is the radial styloid process fracture. Fracture symbol is like this. So there is a radial styloid process fracture, but here the radial carpal joint is normal. Not, but in the Barton's fracture there is a radiocarpal joint subluxation. Here it is normal in the Chauffeur's fracture. Coming to Smith's fracture, that is a reverse Colles fracture. It is an extra-articular, not an intra-articular like Barton's and Chauffeur's. It is an extra-articular fracture of the distal end of the radius with anterior displacement or the volar displacement of the distal fragment. So there is a fracture, extra-articular fracture of the distal end of the radius, along with there is an anterior displacement of the distal fragment. So it is known as garden spade deformity. Garden spade deformity. Complication is malunion. Colles fracture mainly seen in the elderly people with falling in outstretched hand, falling of outstretched hand. It is also an extra-articular fracture like Smith fracture of the distal end of the radius, same. But here is the posterior or the dorsal displacement of the distal fragment, making it as a dinner fork deformity. Dinner fork deformity. So the displacement can be in dorsal, it can be impact, it can be lateral, or it can be supinate. So complication is the finger stiffness and the malunion. So this is the complication. Now coming to the scaphoid fracture. So scaphoid fracture is the most common carpal bone which gets fractured. It is seen in the falling of outstretched hand in the adult. In children, falling of outstretched hand is the supracondylar fracture of the humerus. But here it is the scaphoid fracture in case of adult. Colles fracture in case of elderly person. Falling of outstretched hand. Most common site is the wrist joint, and clinical feature is the tenderness and swelling of the anatomical snap box, because anatomical snap box scaphoid forms the base of the anatomical snap box. The X-ray is the oblique X-ray view. We have to take posterior anterior view of 15-degree ulnar deviation. Complication is the avascular necrosis of the proximal pole. So there is a avascular necrosis of the proximal pole, because the radial artery is compressed, superficial branch of the radial artery is compressed. So there is a, due to compression, there is a avascular necrosis of the proximal pole. So what is the management? If the fracture segment is undisplaced, scaphoid cast or the glass cast is given, and if it is displaced, then the ORIF, that means open reduction internal fixation with Habert's screw. Coming to Bennett's fracture, Bennett's fracture is the intra-articular fracture of the first metacarpal joint. That is the first metacarpal bone. There is a oblique displaced fracture, which is the Bennett's fracture. Now the Rolando fracture is the intra-articular fracture like Bennett's fracture of the first metacarpal bone, but it is a T or Y-shaped comminuted fracture. So there is a comminuted fracture, but it is less displaced fracture. Boxer fracture is the fifth metacarpal bone. The neck of the fifth metacarpal bone fracture is known as the Boxer's fracture. Mallet finger is the avulsion of the extensor tendon from the dorsal aspect of the base of the phalanx. It is a flexion deformity at DIP joint, distal interphalangeal joint. There is a flexion deformity. So avulsion of the extensor tendon avulsion. Okay. Jersey's finger is the avulsion of the flexor tendon, that is the flexor digitorum profundus, specifically from the volar aspect of the base of the dorsal phalanx, that is the anterior aspect. Okay, it is the dorsal aspect or the posterior aspect, it is the anterior aspect or the volar aspect. Mid-lung deformity is a pediatric deformity, pediatric bilateral pediatric congenital deformity due to the growth retardation of the ulnar aspect of the distal end of the radial fascia. So ulnar is more than the radius. Ulnar growth is more than the radius in the distal aspect. So there is a prominent ulnar known as ulnar variance positive. If the radius is prominent, then the radial ulnar variance is negative. It also forms a dinner fork deformity. So dinner fork deformity is seen in the mid-lung deformity and also in the Colles fracture. So there is a dinner fork deformity. Management is Dirac's osteotomy. Dirac's type of osteotomy. Gamekeeper's thumb or Skyer's thumb. It is a avulsion of the ulnar collateral ligament from the first metacarpophalangeal joint. So avulsion of the ulnar collateral ligament from the first metacarpophalangeal joint. So this is about the fractures of the elbow, forearm and the wrist joint and their eponyms. Thank you.